into it. We brought one of our other team members here, Ambereen, over from Oak Brook, and we asked her to come here today to talk about treatment planning and the SOP for that. And so, with that said, I'll just let Ambereen take over.
Thanks, Will. Good morning, everybody.
Good morning.
Thank you. Alrighty. As Will mentioned, I am the project manager over at Arch Dental. A little bit about my background. I have been in dentistry for many years. I've been at practices large and small. I've seen it all, from Great Lakes Dental Partners to a mom and pop dental office. So the one commonality you'll find within all of these practices is this standard operating procedure of treatment planning. It helps dental practices scale their business. It helps the team become more efficient and collaborative. And it also helps us educate our patients better while also delivering the best patient care. So let's go ahead and get into it. So as I explained this guide to treatment planning, we're going to do it through an example. It'll be Jarrell's day at the dentist. Okay, we're going to follow this patient from the beginning to the end of his appointment, and we'll go through each phase and we'll explain some key points that we want to follow. So just as an overview of where we're going to be following Jarrell from when he arrives to the operatory. We'll be leaving Jarrell for just a moment as we game plan for our treatment plan, and of course when we close and actually deliver the treatment plan. So first and foremost, our patient is here. This is Jarrell, bright and smiling. He's our first patient in the morning, 8 a.m. Now we've all been at the front desk. There's the phone ringing, the computer is either on fire or has stopped working entirely, and now there's a patient in front of you waiting to be checked in with this beautiful smile. It's important that we set the tone for the appointment, okay? Take the 1 second, look up, make eye contact. Hi, good morning. At this point, they'll give you some sort of feedback, tell you their name. Hey, I'm Jarrell, I'm checking in, I have an 8 a.m. appointment. Morning, Jarrell, how's your day going so far? Get them checked in. Health history update. This one gets off on the side sometimes. We lose track of it, but it's important. It gives us important information that we want to track not only for today's appointment, but for future appointments. There's things like blood pressure medication that can indicate dry mouth. It'll give us an increased sensitivity blood pressure medication. So we want to have all the important information. As we go through these phases, there's 3 things that I want you to remember. Okay, these are the 3 action items that we're going to be using, okay, throughout the entire process. 1, acknowledgement. Okay, they're telling us something, we hear them. 2, we're listening. Sometimes being an active listener can be hard. There's a lot going on, but we want to make sure when our patient is speaking, we're actively listening. And 3, we're being accurate. Okay? We're giving our patient the best care. We're giving information. We're giving feedback. Okay? So in this moment, we're going to be listening. We're going to be acknowledging. We're making the eye contact. We're listening. Listening can be in different forms. Listening is not just with our ears. We're listening with our eyes. We're looking at facial expression. We're looking at body language. We're listening with our health history update. We're intaking information from this patient. Now, acknowledgement. We've acknowledged the patient is here, so let's get them in. Let's be accurate. We've got 5 minutes. Let's get this patient into the room, guys. Now we're in the room. At this point, there's this handoff, right? There's an assistant, there's a hygienist, there's somebody that has taken over on this patient. And although we've set the tone, hey, Jarrell's family. We know Jarrell. Jarrell's one at Smiles, right? Smiles on Randolph, he's part of the family, but he probably does not remember you. Take the second, introduce yourself. Hi, my name is Ambereen. I'm going to be assisting the doctor today. Get the patient comfortable. Maybe start out with an opener question. How's your day going so far? How's the rain? Oh, it's just been a gloomy morning, hasn't it? Set the tone. And now we're going to get information. At this stage, a lot of it is gathering information. What's going on? How long has it been happening? Where is the pain? Gather all of your information. X-rays. If he's in for a hygiene appointment, if it's probing, we're doing probings. We're doing a quick initial exam. Take a look in the area. Is there any swelling? Is there any redness? Is there an indication of an abscess? All of this information is going to help give you an idea of where this appointment is going, and it's also going to help doctor When you hand off that information, it'll help them better diagnose and treatment plan. So now we're going to tell Jarrell already. Thank you, Jarrell. I'm going to go ahead and get doctor. I'll be back in a few moments. Acknowledgement, remember? We want to make sure we're letting the patient know at each phase what's going on. We don't want to leave them in the blue. So now we're going in. We've left Jarrell. He's hanging out in the room. We're going to get doctor. So I've had Jarrell. I'm going to go see Dr. Weiss. I'm going to let Dr. Weiss know, hey, I've got Jarrell. He's here. We took an x-ray. He's having pain on the lower right side. It's been happening for 3 days now. It's keeping him up at night. He's taking ibuprofen for the pain. I noticed some swelling. We want to be clear, concise, brief. Get to the key points and keep it at that. Doctor to assistant. At this point, if there is some sort of idea of where we're going with the treatment plan, it's good to know. That way we can game plan in our mind of how we want to navigate that conversation. It's not happening yet, but we want to be prepared for that. So, do we know any recommended treatment? Are we going to offer a discount or a payment plan to this patient? And how urgent is this treatment? Does Jarrell need to get this tooth extracted today? Are we at risk of infection? Or is it, you know what, it's not high priority right now. We can touch base on this again at your next hygiene appointment. You've got time. We want to know how urgent the need of this treatment is. All of this information is going to help you when you go into the treatment plan. That way, this patient has all the information they need to make their decision of whether or not they're going to go through with treatment. So now doctor has gone in, he's done his exam, he confirmed treatment. We're going to get ready to treatment plan, okay? So you might think, let me just print the treatment plan, I'll go in. Hold on a second. There's some things we need. First and foremost, we need a printed treatment plan. This is a physical copy. Ideally, at the end of the appointment, after they sign, a copy goes to the patient, copy stays for our records. On that treatment plan, if you'd like for the patient to have a copy, that way they can make notes of their own, or if you'd like so you can make notes of your own, just make sure you have a copy that the patient is leaving with, you have a copy of that one. Knowledge of what treatment is recommended. Now that's not just the knowledge of, okay, they need a crown, but what does a crown entail? What are the phases? What appointments do they need? What will they be doing at the treatment itself? You'll get asked a lot of questions, so it's good to know the clinical side as well. So if you can learn, I'd highly recommend it. But as long as you know the basics, it'll also help you. Knowledge of any payment plan or discount offered. This will help you because it gets very uncomfortable when a patient asks, hey, is there any discount offered? And you have to leave the room and say, you know what, let me go ask doctor. You know what, let me go ask management. And if the answer is no, you're going to have a really tough time navigating that conversation. It looks bad on the practice, it looks bad on the doctor. We want to avoid that. We want to be at a place of confidence. That's our last thing, confidence. We are the experts on this. We've worked in dentistry, we know what we're talking about. Have that confidence. Don't let the patient intimidate you or feel that you are on the back foot. We're just educating our patients. That's the base of where we're going with this. Now you'd think, all right, we've got all our stuff ready to go. Oh, not yet. Hold on. There's some things we're leaving at the door. Any judgment, any preconceived notion of what this patient's financial background is, interest in pursuing treatment. You'll have patients, we've all seen it, patients that come in that don't look like they could pursue treatment. They drop the deposit right then, they get started right then. We have patients that come in that maybe they've neglected their oral health a lot in the past. They're interested in getting back to a healthy place. They get started on treatment the same day. We leave all of this at the door. Our goal is to educate this patient on what is in their best interest. Now, let's go ahead and go in and get started with our treatment plan. We've got our treatment plan in hand, going in. Hey, Jarrell, looks like doctor has recommended treatment for you. Looks like the treatment will be an implant in this case. We're going to take some time. I wouldn't go in and hand the sheet over. There's a lot of information on there. You'll lose them immediately because they'll just start reading. Take the time, just talk to them, ease into it. We're going to educate. A lot of times when doctor goes in and presents treatment or recommends treatment, maybe there isn't enough time for doctor to sit down and really explain it, okay? Or if they have explained it, take the time to just double down on what doctor said. Use a lot of layman's terms. We are so deep into dentistry sometimes, we expect patients to know what a PFM is, and they're looking at you like, what? So take the time, explain what we're doing, what's recommended, why do you need it? A confused mind will not agree to treatment. Somebody is not going to give you $4,000 for treatment they don't even understand. So take the time to explain why it's necessary. Explain appointment scheduling. That's people, although we're here day to day, there's schedules outside. There's kids' schedules, there's work schedules, there's the camping trip. There's a lot going on in patients' lives. They have to also tailor this within their own lives. We've given them a lot of information. And in the between, they may be asking you some questions, and that's a good sign. This is the phase where you'll get the most unhinged stories, okay? And we've all heard them. Patients will sit there and you'll be their therapist and they'll tell you what happened, why they're at the point that they're at. I clearly remember this story where I was going into treatment plan for a patient. He needed a crown because his filling kept popping out. And he told me, Amber, you know what happened, why my filling came out? And I said, what happened? He said, well, I was on a first date with this girl. I was eating a steak. It popped out right in my mouth and I felt it. And I didn't know what to do, so I just swallowed it. And I said, you swallowed it? He's like, yeah, I couldn't just take it out of my mouth. I mean, I was on a first date with the girl. She was really pretty. He ended up marrying her and he brought her on as a patient. So you'll hear, and we've all got them. And if you have a really good one, stop me before I leave so I can hear it. I love hearing those stories. So it's great when they're taking you in as a confidant. Make that connection with them, okay? You're there within the dental office, okay? The doctor-patient relationship can sometimes be a little intimidating, but with you, you're a friend. You're a listening ear. Maintain that relationship. Answer any questions. The questions that they ask you will likely be an indication of what may be stopping them from treatment down the line. They're asking you a lot of questions of how much is this going to cost? Is there payment plan options? Likely that there is some financial hardship that may be stopping them from pursuing treatment. They're asking you things along the lines of, is it going to hurt? Do I get anesthesia? You guys offer local anesthesia? Maybe explain the dental clinical part of it a little bit more. Dental anxiety is real. And there have been times where, as a treatment coordinator, I will go in before a patient starts even a filling appointment, and I'll just sit there and we'll hold hands and we'll say a quick prayer together, and they'll feel a lot better. So, and at the last but not least, we're listening. Listen to what your patient is saying. Actively listen. They will tell you what will be stopping them from pursuing treatment. Listen to this, acknowledge it, and address their concern. Now, this treatment plan, although we have probably seen it a million times, there's a lot of stuff on here. There's a whole essay written at the bottom. What is all of this? When you present the treatment, can somebody guess what the first thing a patient will go to? Just yell it out. Dollar amount? Yeah. They're going either straight right here, or right here. What's the problem though? Right here. Does somebody notice? Anybody play those games when they were a kid? Hey, find the difference between the two pictures. There's a big difference between this number and this number. This can get really confusing. So you want to take the time and cover a few points on this treatment plan. Okay? First, they're going to look right here, but you want to divert their attention right back here. We told them an implant, but what in the world is an endoseal implant placement? What is that? Now, if you took your time and you educated the patient, you told them, hey, the implant is broken into two parts. There's one part that's the screw. It goes below the gum line. It is in the bone. It's essentially the equivalent of a root on a natural tooth. And the full porcelain ceramic crown, that's the actual tooth that sits on top. So then you can go back and say, hey, remember we talked about those two parts? Yeah, that's right here. It's broken into two parts. This is the root. This is the crown. Then you can go into the finances. Now, does anyone have take a guess? Why would these two numbers be different?
There's an adjustment in between. There's no primary insurance. Maybe based off of like you guys already know what the contract.
You got it. So you were getting there and you got it right at the end. We are a network. Jarrell has United Healthcare Insurance and our office is a network. These are our office fees. Now, since we are contracted with United Health Insurance, we're going to go ahead and present him the contracted fees with his insurance. Now, unfortunately, Jarrell does not have primary insurance coverage. Now, at this point, Jarrell is going to say, wait, that's not true. I have insurance. I get it through work. I have 50% coverage. Why is that not seen? Well, implant coverage, isn't included in many plans. So you want to explain that. If there is primary insurance coverage, explain that as well. Jarrell, good news. Looks like you have 80% coverage. That's amazing. The wording you use here is going to help you a lot. That's amazing. You have 80% coverage. This is a great plan. So this is how much your estimated insurance coverage is, and this is your estimated patient portion. Now, there's other factors that also play into finances. Plan deductibles. A lot of times patients will miss this. They're going to say, wait, I have 80% coverage. Why am I not getting the full 80? Well, Jarrell, you haven't met your plan deductible. Now, a deductible is essentially the minimum that you have to meet in order for you to get the full 80%. Now, if Jarrell has had any work done before, we all know this number is going to be way less than $1,000. So this is the annual max, how much the maximum an insurance plan will cover. He's not going to get any more than this. And especially for a treatment plan such as an implant, well, he could get 50% coverage, but he'll only get 50% coverage up to $1,000. Now, why would we want to explain benefits expire? That's a good point. Yeah. And let's say that we're in December. What procedure would be an issue to keep in mind? The date, seat date. That's right, seat dates for a crown. We start a crown end of December. A lot of insurance plans will only pay on the seat date. Jarrell's not getting that coverage then. So you want to explain all of this. And of course, last but not least, treatment plan case total. This number is really confusing sometimes. Why? We present multiple options sometimes, right? There's filling versus crown. There's root canal crown as opposed to extraction. Depending on what software you use, this number may or may not be right. A lot of times it'll just add up everything and give you that number right there. So you're going to hand over that sheet of paper, it says treatment plan on top, and the first number they see is going to say 5,000 or 6,000 for one filling. They're going to say, you're out of your mind. So explain, and I would probably write some notes next to it. Or I'd even just cross it out. Hey, look below. We have options. Make notes for your patients. We've just given them so much information. They will remember it till the second they walk out the door and it's all gone. Make notes so that if they are going to take the time to think about it, they remember all the things we talked about. Now, we just threw a lot of information at Jarrell. He's sitting there in shock. His mouth is open. We want to stop talking. This is a lot of information we just gave him. Give him a second. Doesn't have to be an uncomfortable 2-minute moment of silence. Just a beat or two. Let him digest a little bit. He'll likely guide the conversation from here. If there's a question, he'll ask it. If if he says, can we get started right now? You say, all right, let's go ahead and sign. Let's get started. If you have the time. Or you say, you know what? Let's get you scheduled. Just give him a moment. This is crucial. This is where our listening comes in. We look at the facial expression. We look at the body language. We listen to the words he's telling us. And of course, answer any questions that there's left over. There's hesitancy, acknowledge the hesitancy. Answer the questions. Usually questions will come up at every stage of treatment planning. You could be walking out the door and this patient is ready to get started with treatment and they'll still have questions. Just our main goal is to educate and to let patients know what we are presenting is in their best interest. So now we've presented all of the treatment plan, and there's this big essay at the bottom. Now, there's a lot of words there, but you really want to make sure you cover it because we've all worked with insurances. Show of hands, who's worked with insurance and knows the headache that it is? Oh yeah, okay. We all know the pain. There are times when you'll submit a claim to the insurance and they won't pay. Just a really silly reason they'll give you and they won't pay. So you want to make sure the patient knows this is just an estimate. We will only know how much insurance will cover once we submit that claim and they pay it. So let them know if there's anything that is not paid, if your benefits expire, if you go and get other treatment done, any balance that's left over. Remember, it is the patient responsibility. And consent for dental treatment. This just says, all right, I did a good job. I explained everything to you. We answered all of your questions and you understand to the best of your ability and you're ready to get started with treatment. Now at this point, we have some sort of heading where we're going. Now, easy, patients like, I'm ready. You are such a superstar. You explained everything to me. I feel comfortable. I love your office. You guys treat me like family. Let's get started. We sign the treatment plan and we schedule. We always schedule. Patient says, I have to go home, look at my calendar. Make sure you call them before the end of the day. Schedule. Large treatment appointments, implants, crowns, anything that requires more of doctor's time, I'd say more than an hour, collect a deposit. Collecting in full is ideal, but if you get a lot of pushback, you can collect 50%. Now, that conversation can be hard to navigate, but it's a lot about the wording, right? When you tell a patient, doctor really wants to devote these 2 hours so that he can work on you and focus just on you. You're more likely to, you feel a little special. You're like, oh my God, he wants to just me? Wow, thank you. Some patients will be receptive to it. Others may give you a little bit pushback. Try to navigate, read, acknowledge, again, listen. But collecting. If we're booking that amount of time, we want to make sure we have something so that we can hold them to that appointment. Now, if they say, you know what, I need a few days to think about it. Remember, we are asking for almost $3,000. That's a lot of money. It will take a day or two for somebody to commit to treatment like that. We know it's in their best interest, but it's also a financial decision for people. There's other things that are going on for them. We acknowledge that and we let them know, okay, I understand. Now, as we're walking up to the front and we're getting this patient checked out, you want to schedule maybe something informal, right? Something within the next 3 days to give them a call. Say, hey, you know what? How about I give you a call on Friday? You take some time, think it over, and we'll touch base, see if you have any more questions. It's really informal, nothing like I'll give you a call exactly at this time, just so that they have some time to think about it, but you're not waiting too long where they've either forgotten the information you've given them or It's just out of sight, out of mind. Now, at that second call, they'll give you, again, guidance. If they say, I'm going to think it over, this is that scheduling of the call. They're going to say, on that second call, they'll let you know, I'm going to wait till my next cleaning, or I'm going to wait till I have some time off from work. I'm going to wait till next year to get started on this. Remember, we got that key piece of information from doctor about urgency of the treatment? Well, Jarrell needs this treatment. There's a good chance that within the next month or so, he's going to start feeling pain. This decay is going to get really bad to the point where he's at risk of infection. This is when we let them know, hey, doctor really recommends that you get this done sooner rather than later. We really want to avoid you being in pain and coming in as an emergency patient. So I understand that you're not able to commit to treatment currently, but if you're able to work through your schedule and get started on treatment, we'd highly recommend it. If they tell you, I still don't understand the treatment, well, we've taken the time, doctor has explained, we've spent some time explaining. It may be a good idea to get this patient in for a consult, maybe sometime after hours, maybe on a day where it's an admin day, just some time where doctor can sit down, and maybe you can sit down as well, and we can walk through the procedure, go through the steps required, scheduling, and maybe we can even showcase doctor's skills. We can show the successful cases we've had for implants. We can show pictures of seamless implants, you know, that beautiful smile of the front, of those front two teeth, and you can't even tell. Those are implants? Yeah, those are implants. So at that second phone call, if they say, they give you any sort of heading, use it to guide the conversation. Now, if they tell you, I can't get treatment right now. It's not I have other things going on. I've got kids. I've unfortunately was just recently laid off. Whatever it is, acknowledge that. Yes, we are in the medical field, and what we're recommending is in their best interest. But we also are not here to bankrupt anybody. We want what's best for them, and that's what we need to put across. And if we do that, although they're not getting treatment currently, they may be getting treatment in the future. When it's right for them, we want to leave that impression, the impression that this office is here for what their best interest is. This office listens to them. This office acknowledged their concerns and took the time to sit there and answer all of their questions. If we do all of these things, this patient, say in about a year, is going to give you a cold call and say, hey, I remember you told me I needed an implant. I'm ready to get scheduled. So now if we do all of these steps, and these steps may be different, right? We may need to tailor it for your practice. These are guiding steps. We tailor it to your practice. We'll see higher patient retention rates. And you're going to notice patients are going to say, hey, thank you. You told me, you educated me something about dentistry. I didn't know dentistry has come this far. We can scan now. You'll notice patients be more receptive to treatment. Anybody have any questions within the treatment planning process?
I got a question.
Yes.
Julie, set up. I don't think all of our assistants know the discount. Can you explain what $500 and all? Can you explain all that right now?
Anything the patient is paying out of pocket, $500 over is 7%. And then after the 1,500 out of pocket for the patient is 10%. So payment in full, right? The one time.
Okay.
And then we also offer that this is like 3 or 4. Give or take how many appointments is breaking out.
I think that's what we need help on assistance. Some of the assistants don't even know that. And I mean, I love the way you presented this. This is how we should be doing, but from the assistant, the doctor, that. And we're not doing that. And also, the way she explained, that if we have an hour, 2 hour appointments, like Dr. Weiss has been talking to me about this, we have to tell them is, doctors an hour just on you. And it is so important the front desk reflect. Because we still have patients scheduled for 3 hours, and then the last minute they cancel, and we have no reflection up front on that.
Today we have that patient that has the 6 crowns in the hygiene room. One, I showed her a picture of having 6 crowns before and after. Thought she was like, oh my god, I want that. So she immediately already booked. And I told her, I was like, look, this is gonna be my time for you. If you want it all done, that's 3 hours. I need to respect between both of us. Value my time, I'm gonna value yours. If you're gonna do it all at once, I'll say yes, but you gotta show up, you gotta be there. If not, I can't do it. And it turns out she went and paid me full, and she was good with it. Yeah. So
That's what I'm talking about. It is so important. Like from Julianne, where are you? And like we explained yesterday, we had Ashley who was looking for sunbed. Nobody up front knew about sunbed. Patients waiting for 25 minutes, and then we go up there, we're ready to take that patient. Nobody explained about sunbed. We have to wait another 20 minutes. Gotta stop. Gotta stop. We gotta be all on the same page. And then what she just explained, follow up. As an assistant, as a hygienist, you have to follow up. If the patient is not scheduled after we explain all this, and as an assistant, we've done cases where a patient comes in, heard so many good things about us, and want to do implant on number 4 and 5. I still never forgot that patient. Patient waited for an hour and just sat there waiting for treatment plan. My assistant is just sitting there. I go, what are you doing? Like, waiting for treatment plan. No conversation explaining it. It is so important that we learn these steps. Not just the assistants from that. You gotta be on the same page every single one of them. I thank you. It was incredible.
Thank you.
Eye-opening.
thank you, Ambereen.
Thanks. Absolutely.
I just want to say a couple things. It boils down to one thing: it's the patient experience.